Hey guys, this is Simon with HiFlex Health Performance. Just a thought I had as I was going to my next client's house. I've been fortunate enough for the last several years to be involved with youth athletics, particularly basketball. And something that we all noticed is due to the pandemic and the limitations that have been placed upon us with either lack of a facility or lack of a structured environment for strength and conditioning and agility training, is that window was significantly smaller. And I believe the aftermath of that is the reason that I ended up with quite a few patients that developed musculoskeletal injuries as a result from a lack of a structured approach to prepare their bodies accordingly. Great example. If you're playing in a weekend tournament, and so this is travel level basketball, and if you're going to play a minimum of 3 games with the potential of up to 5, maybe even 6 games, depending on the format, that's a lot of basketball. And that's a lot of basketball for someone that traditionally may have had anywhere between 6 to 8, maybe even 10 weeks of conditioning under their belt, that instead may have only have had 2, 3, 4 weeks. And so the conditions I would most commonly see, especially in my female athletes, something that most people are familiar with is jumper's knee. We call it like a patellofemoral type of issue, or patella tendonitis. And that's essentially where structure is getting really overworked, overstressed to the point where it actually starts to show signs of breakdown. And that's why your body kind of kicks that sign, that red flag of inflammation, swelling, and pain. And so with the girls that I worked with particularly, we developed a program to essentially work on their overall conditioning. We were able to do Zoom workouts. We were able to do more specific physical therapy interventions to help to remedy and then also strengthen and reinforce not only at the site where the injury occurred, but really the whole body. And I'm very proud to say that the current format that I'm with HiFlex is, honestly, we hear where your primary complaint is, but we're going to ask a lot more questions. We're going to ask you, what do you want to achieve? We find the weakest link, strengthen it, and then strengthen every link around it. Because I'm telling you, if you're not getting your hips to the point of being some of the strongest muscle groups in your body, your knee is going to suffer, your ankle is going to suffer, your spine is going to suffer. And the same way I can say with the relationship between the low back and hips. Another thing that I saw that was pretty interesting is there were a lot more instances of lumbar strains, low back pain due to a muscle strain, which typically in the youth, you don't really see that often. And again, we go back and ask the questions why. It's my favorite question when it comes to musculoskeletal dysfunction. Why? Why are these things happening? And then we kind of pinpoint and go through every possible variable as it goes mechanically, from the foot hitting the floor and from the spine coming down, on what are all the influences. Is it footwear? Is it foot mechanics? Is it hip strength? Is it lumbar mobility? And really kind of pick it apart. Dr. Chelsea does an incredible job of being extremely thorough through her evaluations, which then when I follow up with the patient, essentially I take my role very much so as the mechanic. Dr. Chelsea will give me the diagnostics. Here's the findings. Here's what we see. And essentially we'll say, okay, here's what we identified as far as deficits. Let's put a plan together to remedy that. And I pride myself on preparation and essentially the education that I've received over my 17 years of practice to be able to make those implementations of interventions to be as effective and as efficient as possible. I'll be trying to do more of these as time goes on. Certainly, if you guys have any questions, concerns, just give us a shout. You can throw questions out on our site. You can throw questions out on Facebook or any of the social media platforms that we're on, which is Facebook, Instagram, LinkedIn. And we'll definitely keep in touch and kind of keep this conversation going. And definitely keep us in mind. If you have a young athlete, and honestly, I say young athlete, but I've worked with the middle school, high school, college level to weekend warriors really since this time last summer under HiFlex, to really kind of pinpoint what the limitations are and what's keeping you from performing the activity that you're absolutely passionate about. You guys have a great day. Talk to you soon.